Everyone, welcome to GrowMed. Welcome back to another session of discussing 10 high yield topics which are most important, and these topics are frequently asked in the FMGE. So, I have tried to divide these into various subjects and cover each 10 topics from each subject so that it will help you in your last minute revisions, and these are very useful and high yield because in the last minutes by watching these videos you will be easily able to solve most of the question. So do watch the other videos which I have made for the other subjects. The link will be given in the description box, and if at all you are new to GrowMed, subscribe to GrowMed and join with me on the Telegram to make your FMG preparation funful and enjoyable. So one of the most important topic from the physiology, that is the mechanoreceptors, asked multiple time, and this is a repeat topic. So we will discuss what all the questions have been asked. So these mechanoreceptors, they are classified into the various types. Uh, so Pacinian corpuscle, Meissner's corpuscle, then Ruffini's, then Merkel receptor. So these four things, these are very important, and hair follicle also is an important. Then the type of adaptation shown by this. So Pacinian corpuscle are very rapidly acting. The Meissner's are also rapidly acting. Then the hair follicle also rapidly. Whereas the Ruffini and the corpuscle, these two are the slow acting receptors. So questions have been asked on this, that which of the following would be the rapidly acting, or which of the following is the slow acting. And location. So we'll look at the location. Pacinian is present in the subcutaneous layer of the skin. Then dermis, non-hairy skin, Meissner's corpuscle, then hairy skin, hair follicle, then the dermis, hairy ligament, and the tendon. So the Ruffini corpuscle is present at these three locations: the dermis, ligament, and the tendon. And these are Merkel receptors. These are present on the epidermis, non-hairy skin, whereas tactile receptors, these are present on the hairy skin. Tactile is not that much important from the FMG point of view, but yeah, this can be asked in the NEET PG. Then fibers. So nerve fibers, these are all not A delta, these are actually A beta fibers. These all are a kind of an A beta fibers, and we'll discuss about those A beta fibers also now here. And we will now discuss about their functions, which pathway or which senses they carry, because questions are repeatedly asked on this part. So Pacinian corpuscle, it carries the fast vibrations. So vibrations are also two types, fast and slow. The fast vibrations carried by the Pacinian, and the slow vibrations, these are carried out by the Meissner's corpuscle. Then the light touch by the Meissner corpuscle, and the pressure. So the deep pressure, this is also carried out by the Pacinian corpuscle. Then movement of the hair follicle. Then the Ruffini corpuscle, this carries the stretch and the joint rotation, whereas the other two, Merkel receptor and the tactile, so these will be carrying the light touch. So this was a PYQ, the fast vibration of PYQ, then this was a PYQ, this was a PYQ, and then this was a PYQ. So we already discussed the four PYQs in a single table. So look at it, how important this topic is. Then moving on to the nerve fibers. So nerve fibers are also classified into various categories A, B, C. The A category is again classified into alpha, beta, gamma, and delta. So the A alpha fibers, these are the fastest fibers, and these carry the proprioception or the first pain. So this was a PYQ, that which of the following fibers will be carrying the proprioception and the fastest. So B will be carrying the touch and the pressure, and the gamma will be carrying the muscle. So anything, any senses related to the muscle or the muscle pain or must change in the muscle, so these things are carried by the A gamma, and A delta will be carrying the pain and temperature. So look at these, the things which are marked in the yellow, these are the spinothalamic tract, the spinal tracts mainly, the spinal tracts which will be carrying the various sensations. So the dorsal column fibers, these are made up of the A alpha and the A beta, whereas the anterolateral fibers of the spinal cord, these are carried by the A delta. Then B, so B comprises of the preganglionic fibers coming from the ANS, that is the autonomic nervous system. Then C will be carrying the slow or the somatic pain, mainly related to the viscera. So viscera means the stomach, then related to other solid organs, the stomach, the intestine, kidney, and all. So this pain is carried out by the C fibers. Then these are also anterolateral fibers, and the A and B, these are myelinated, and the C1 are the unmyelinated. So these are the things which you must remember from the nerve fibers. And also I've uploaded a video, complete video on the spinal tract, because it is a very important topic in us in relation with the physiology, also comes in the anatomy also, and sometimes in other subjects also. Because if there is damage to these levels, then they'll be causing various diseases also. So you need to remember these spinal tracts and do watch that video also. Then some important things related to these nerve fibers. So questions are asked that which of the following is most sensitive to pressure, hypoxia and the local anesthesia. So for the pressure, it is the A which are the most sensitive, and in the A it is the A alpha which is most sensitive to the pressure. Then this is the sequence of the other uh, nerve fibers. Then B is most sensitive to the hypoxia, and this is the sequence in the order which is least sensitive to the hypoxia, and it is the C. Then C, so this one is a little bit controversial question. And local anesthesia, so in various books it's given as A alpha and A delta, so go with this answer, better to go with this answer instead of C. So local anesthesia, so most sensitive fibers will be the A delta as well as the A gamma fibers. So we've discussed two highly important topics and a repeat topic. Then moving on to the auscultation area. So you need to remember these areas and mark up this image, because image based question can also be asked on this. So they'll mark these points 1, 2, 3 and 4, and they'll ask you the marking, which of the following is correct or which of the following is wrong. ऐसे करके they can make in any pattern. So we'll look at it. So the second intercostal space which comes here, this point, this is the aortic point, and we can hear the sounds related to the aortic valve. Okay, so second intercostal space, right side. Then a pulmonic, uh, so it is also the second intercostal space but heard at the left side. Then the Erb's point heard at the third intercostal space. Then tricuspid fourth or fifth intercostal space, and the mitral or the apex fifth intercostal space, or these on the left side. So you need to mark up this image and also remember these areas. Then moving on to pressure volume loop. So this is also important, and image based questions was asked on this. So they'll mark any of the structure and they'll ask that what is happening in this phase. So we'll look at those things. So this image, you can see here that here on the x-axis there is the pressure of the left ventricle, and this one is the volume of the left ventricle. So what's happening in this graph is that due to the changes in the volume and due to the pressure changes, we can see certain things in the heart. So we will look at those things. So at the point A, so this one is the point A, and what happens here is there will be mitral valve opening. The mitral valve will be opening here on the A, and on the C, what will be happening is the mitral valve closes, and it stands for the end diastolic volume. End diastolic volume and mitral valve will be closing on the C. Then what happens on the D is the aortic valve will be opening, and F aortic valve closes. So these are the important things which you must remember. 1, 2, 3 and 4. And in the past year the question was asked on this, so they had marked this area and they had asked that what is happening in this stage. So it was the aortic valve opening. So you need to remember this image as well as the marking present. So the line here, it suggests the isovolumetric relaxation, as you can see here. So here it will be isovolumetric relaxation occurring. Then this one is the ventricular ejection. This one is the isovolumetric contraction, and then this one is the ventricular filling. So as you can see here that this is a chart containing the whole cardiac cycle. So the cardiac cycle has been described in a flow like pattern. If there is certain diseases present, then the pressure volume loop, we can see changes in this also. So let's look at them. In case of aortic stenosis, so this one is the normal which should be occurring. But in case of aortic stenosis, so the pressure will increase, and and the loop shifts towards the left side. So you can see that this changes will be happening in the aortic stenosis. Then in case of mitral stenosis, you can see this appearance, and in case of aortic regurgitation, this finding can be seen, that you can see here that the volume loop, it is moving to the left side, extremely moving to the left side, and also the volume of the blood is increased. And in case of mitral regurgitation, you can see this appearance. So these are some important findings seen with the various diseases which you must remember. Then moving on to another important topic, which is the O2 dissociation curve. So it is the O2 dissociation curve, and the shape is the sigmoid or the S shape, as you can appreciate here. So what happens in this case is there are various factors which will be affecting this dissociation curve, and these will be causing changes in the curve. So we look at those factors and questions are asked on those factors. So the factors which will be causing the right shift are increase in the temperature, increase in the 2 3D pg, and increase in the H plus ion. And in another one factor is the decrease pH. So if at all these things are seen, then the curve will shift to the right side. And decrease temperature, all the things opposite of this one, decrease 2 3 dpg and decrease H plus CO2 and increase in the pH. So these things will be causing the curve to shift to the left side. So questions are asked on this, that which of the following factors will cause the right shift or the left shift. So you need to mug up these factors. Then moving on to another very important topic, that is the JVP. So you cannot miss this topic, JVP. So we will look at the things which are asked, and also these questions are asked in relation with the medicine. So this JVP, it has various waveforms, the A, X, C, X, V, Y. So you need to remember this image as well as the waveforms, because image based question can be asked. So the A stands for the contraction of the atria, atrial contraction. X stands for the atrial relaxation. Then C, tricuspid bulging. Then X, dash, downfall of the tricuspid. V, passive atrial filling. And Y, atrial emptying. So these are the things which will be happening in this wave forms. Then pathological forms of the wave. So a wave will be absent in case of the atrial fibrillation, so a PYQ. Then large a wave seen in case of PAH, pulmonary artery hypertension and pulmonary stenosis. So you can guess here that the lungs are involved. So whenever lung condition is there, like the pulmonary stenosis, pulmonary artery hypertension, then you can see a large a wave. Then non a wave, more larger than the A wave, and complete heart block and ventricular arrhythmia. In these conditions, we can see the Canon A wave. Then moving on to the large V wave seen in case of tricuspid regurgitation and X wave. So this cardiac tamponade and this one. These both are very important. And X wave, so steep X wave is seen in cardiac tamponade and the constructive pericarditis absent in case of tricuspid regurgitation. Then Y wave, steep seen in CP, constructive pericarditis and the tricuspid regurgitation absent in the cardiac tamponade. So questions are frequently asked on this cardiac tamponade, either clinical case or single one-liner kind of. So you need to mug up these things regarding the cardiac tamponade, the X-ray, then the clinical case, how it can be asked, and also the finding seen it. Then increased jugular venous pressure, we say that this sign is called as a positive Kussmaul sign and seen in three conditions: constructive pericarditis, restrictive cardiomyopathy, and third degree heart block. So normally during inspiration, the jugular venous pressure should decrease, but in certain conditions it will be increasing, and this paradoxical rise is called as the positive Kussmaul sign. Then moving on to the BP regulation. So questions are asked on this BP regulation also. So we will look at them. Try to make it easier and simpler by covering only the important things which are asked. So BP regulation done mainly by the three methods: chemical, neural, and the RAS. So RAS is a very huge mechanism, and we will be covering it in the medicine already. So it is that kidneys will be secreting the renin, then the renin will convert to the angiotensin again to the angiotensin 2, and then causing a various pathway. Okay, so it is very huge pathway, and you just need to remember that RAS will be helping to regulate the blood pressure. Then the chemical and the neural pathways. So chemical, vasoconstriction and vasodilation. So these are the factors which will be causing the vasodilation, and these are the factors which will be causing the vasoconstriction to increase the blood pressure or decrease the blood pressure. So you need to mark up these whole things. Then the neural. So neural baroreceptors will be acting as a BP regulator. Then two important sensors present, carotid sensor and the aortic sensor. So these will be sensing the mean arterial pressure and making the changes according to it. Then the DMN, nucleus of the vagus. So dorsal median nucleus of the vagus also helps in BP regulation. So these are the important things that you must remember. That nervous, so nervous will be the VMC. Then kidney, by regulation of the extracellular fluid and the RAS, and local vasodilation and the vasoconstriction. Because questions are asked that which of the following is the local factor for BP regulation, or which of the following factor acts on the nervous system for BP regulation. Then moving on to the feedback mechanisms. So there are two type of feedback mechanisms, positive and negative, and only examples are asked on this, so you need to remember only the examples. So the negative feedback mechanisms, BP regulation, temperature and the baroreceptor. So these all will be the negative feedback mechanisms. Then the positive are the oxytocin, LH, surge, clot formation, micturition reflex and the Head's paradoxical reflex. Then moving on to the reflexes. So three important reflexes as well as PYQs, and there are various other reflexes also, but these are the PYQs, so I've tried to cover it here. So the Bezold Cherish reflex. What happens in this reflex is whenever an irritant substance comes in contact with the body, so the blood pressure will decrease, causing hypotension, bradycardia and decrease in the respiratory rate. So this is the things which we can see in this reflex. Then brain bridge reflex. So whenever there is sudden increase in the blood volume, the heart rate will also be increased, and a good example of this one is the saline. So it was given like an example that a patient had infused with the saline and suddenly there was increase in the heart rate. So what is the cause of this increase in the heart rate? So it was the brain bridge reflex. Then moving on to the Cushing reflex. So what happens in this is whenever there is increase in the intracranial pressure, it will stimulate the CNS, will cause ischemia, and this will cause bradycardia. So this is the Cushing's reflex. Then moving on to the important section, that is the renal physiology, and repeatedly questions are asked from the renal physiology. So we will discuss all those renal physiology questions now. So this is the part of the nephron, and questions are asked on the things that which part will be doing what work, which electrolytes are absorbed or excreted in which part of the nephron. So we all know that these are the very basic things, right? तो ये नेफ्रॉन है, मतलब नेफ्रॉन है, ये ग्लोमेरुलस अपैरेटस है, ये पीसीटी है, ये लूप ऑफ हेनली है, ये पीसीटी, ये सब ठीक है. तो ये हम डिस्कस नहीं करेंगे. We will just discuss the important things. So the questions are asked on a PCT में which all electrolytes are absorbed and which are excreted. So these are the things which are absorbed from this PCT, and it is the glucose, amino acid, then bicarbonate, these electrolytes, vitamins and the proteins, and then these are excreted. So H plus, PAH and the creatinine, so these are secreted from the पीसीटी. मतलब कि देखो यहाँ से ये इलेक्ट्रोलाइट्स आ रही है तो यहाँ पर ये पीसीटी में अब्सॉर्ब होंगी, एंड जो ये वाले हैं H प्लस PAH ये यहाँ पर वापस जाएंगी. ठीक है. सो दिस इज द मैकेनिज्म विच विल बी हैपनिंग इन द PCT. देन मूविंग ऑन टू द थिन लिम्ब ऑफ हेनली, thin limb of loop of Henle. तो इसमें this is freely permeable to the water, so this was also a PYQ. And then the thick ascending limb of the loop of Henle, so it will be having an NKCC channel, so which will be transporting the sodium, chloride and the potassium. तो ये तीनों चीज़ें यहाँ पर secrete होती है, absorb होती है, and this is our diuretic, loop diuretic, which will be acting on this NKCC. Then moving on to the DCT. So DCT impermeable to the urea, and the transporter present here is the sodium chloride transporter, and the thiazide diuretic will be acting upon this channel, so it will be acting on the DCT. Then moving on, so ये वाली सारी चीज़ें थी which you must remember from this renal physiology, the main things. Then moving on, so there's a PYQ one-liner asked that maximum water absorption occurs from the PCT. Then the cells present in the adrenal system, and we will look at the location and the function what they do. So the macula densa cells, so location is the DCT, then function is sodium chloride chemoreceptor which is present. So these will be sensing the sodium and chloride, and they will regulate the tubuloglomerular feedback mechanism. So in short, they'll be stimulating this mechanism so that whenever these levels are less, the sodium and the chloride levels are less in the body, so the body will be absorbing these. Then the JG cells. So JG cells are present in the wall of the efferent arterioles, and these will stimulate the renin synthesis. So this is a PYQ, and what happens is that they will be decreasing the blood pressure. Then peritubular cells, so present in the peritubular capillaries. Then erythropoietin synthesis will be happening, and this will stimulate the colony stimulating unit erythropoietin. Then the mesangial cells, so these are present in the renal glomerulus, and what these will be doing is they will also be stimulating the tubuloglomerular feedback mechanism. Then the intercalated cells present on the DCT and the collecting duct. So these will be doing the acid secretion and the transport of the bicarbonate. So these are the important things and the cells which you must remember. Then moving on to two important things. So questions have been asked that which factors regulate the glomerular filtration rate and which factors decrease it. So the factors which will be increasing are the efferent arterial dilation and the efferent arterial constriction. So these two things will cause increase in the glomerular filtration rate, and the GFR will be reduced in case if there is ADH present. So high levels of the ADH and tubuloglomerular feedback mechanisms. Then the counter current mechanism is present in the kidney, and what happens in this mechanism is there will be H2O outflow in the thin descending limb. So water will be excreted in the thin ascending descending limb, then sodium outflow in the thick descending limb, flow of the tubular fluid from the PCT to the DCT. So these things will be happening in this counter current mechanism to balance the electrolyte and whatever changes are happening in the body. Then moving on to a very important image. So this image is of the excretion. So multiple substances are excreted and their levels are calculated. So we'll look at them. So this first one is the PAH, and this is used to measure the renal blood flow. Then moving on to the creatinine. So creatinine will be more excreted more than the glomerular filtration rate. Matlab these factors, these are used for estimation of the glomerular filtration rate. The inulin is the best to check the glomerular filtration rate because it is equal to the GFR. That means, see, whenever we inulin is present in our body, so it will be coming to the glomerulus, and what happens is that it will be excreted completely in the body. तो यहाँ पे ये ना reabsorption होता है ना ये excretion होता है, इसीलिए this one is considered as the best and it is equal to the glomerular filtration rate. Then creatinine के कैसे होता है कि creatinine is present in the body. Creatinine is also actually the most common thing which we will be using because it is naturally present in the body. So creatinine will be happening like this, that it is secreted like this. तो secretion के वजह से filtration के बाद भी it will be secreted, so ये थोड़ी सी level इसकी बढ़ जाती है creatinine की. That's why it is more than the glomerular filtration rate. Then the excretion of the bicarbonate is lesser then the glomerular filtration rate because these things are absorbed. तो bicarbonate is absorbed. So as we had discussed here, देखो bicarbonate absorb हो रहा ना PCT से, तो यहाँ से तो वो आया, but यहाँ पर it is getting absorbed, तो इसीलिए the levels will get reduced. Then likewise for the glucose also. So almost जितनी भी glucose आ रही है वो सारी ही absorb हो जाती है, so it will be very less. तो यहाँ पर आप देख सकते हैं. So do look at these lines and also the substances because image based questions have been asked on this. So they'll mark any of the line and they'll ask that which substance is being calculated. So that's all in this video, guys. So quickly we have discussed about very important points and also various PYQs we have discussed. Hope this video will help you in your revisions, and Like the video, share it with your friends, and if you're new to GrowMed, subscribe to GrowMed. Thank you so much guys for watching this video. Bye bye.